talking with Mary Beth Bonaventura, the head of the Department of Child Services. In the years leading up to before you took over, when you were appointed by Governor Mike Pence, there was a lot of consolidation of DCS. There were a lot of consolidation at the state level. There was a new hotline that was put into place. There was a lot of criticism coming from judges around the state. I think even at times yourself saying that too much power had been ceded over to Indianapolis. Has that changed at all since you've taken over?
Well, the law changed in 2008, I think it was, that took the agency from being county operated to being state operated. So the Children and Family Fund went to the state coffers, and so we didn't let contracts locally. They were all done at the state level and things like that. And with that came the hotline implementation, which I can tell you I was always in favor of. As an example, prior to the implementation of the hotline, we had 300 ways you could refer and report acts of abuse and neglect, 300. So we had 92 counties, so where were these calls going? So now we have one, and because of that, you can see each year the calls have increased. Last year we had 181,000 reports of abuse and neglect to the hotline. The year before that was 170 something. The year before that was 156 something thousand. And so what that tells me, not so much that abuse and neglect is rising, it means that people understand and know where to call safely, anonymously, and effectively to protect children. So I think that was something that was really needed and has really worked well in the state.
Though at the same time, judges were saying that you were dealing with people who were far away in Indianapolis. They didn't understand the area as well as people on the ground in Lake County and Porter County and elsewhere. Do you think that was a fair criticism?
I think that it was, and because of that, the law's changed. The law last year changed that we take it and the call comes to one central location, and actually we have 5 hotline areas, but they're all routed through one number. And then we take all of the particulars of the case, and then we send it to each county to then substantiate or not substantiate, so that we can know then, because of the nuances in each and every community, the people that live there know that what areas they need to pay a little bit more attention to, or is this a family that we've had contact with before in a way that only locals know. So I think it's the best of both worlds now. So we take it centrally, and then we push it out to the counties to substantiate or not.
Report just came out, well, in the last couple of months, deaths for abuse and neglect in 2012, the latest numbers show that the deaths are down. You have 34. You still have some of these cases are cases where people have had contact with the Department of Child Services. Do you have enough follow-up?
Again, hindsight is always 20/20 vision, and do we have enough follow-up? I think it goes back to that if families participate and comply with what the court orders are, we're mandated to return children to families. Sometimes it's a gut feeling. As a judge, I know that, you sit there and go, oh, I know they've done all this. There's just still this uh-oh feeling. But unfortunately, the uh-oh feeling isn't taken into consideration in what the law says we have to do. And so sometimes, I think sometimes we need more follow-up, maybe longer periods of time with certain families, and that's really the work that we're involved in, is trying to figure out which cases need more attention.
Prior to you taking over, the agency had a lot of criticism for the amount of time it took to investigate deaths. It would take 2 years at times to get deaths. You committed to doing it in 180 days. There's a report out from the Ombudsman for the state that you're not always making that goal. Do you have enough staff to do the job?
Yes, we do. I think that you will see that we just got our fatality report out for 2012. We'll be done with 13 by the end of this year. So we're going to be right on target, because when I got there last year, I'm saying, why are we doing 2011? This is 2013. We need, today's data so that we can educate the public and put procedures in place to protect children better than we're doing. And so, no, we've kind of organized as to who will do what, and we have enough staff for that.
You have enough staff to do it. So why was it taking so long?
I really don't know why it was taking so long. I think that maybe people were deployed to do certain things that they felt was, at that time, that the department felt was more important than that. I can tell you that no death takes 180 days to investigate. I think what maybe you're referring to is, why don't we have these reports timely? And some of it is for the coroner's office, some of it is from the prosecutor's office, and I'm saying, we can resolve all of that in a shorter period of time by staying on those people to get those reports we need so we can be timely and the public has the right to have that done.
This is an agency that has often suffered from very high turnover. At times it's been as much as 50% over in the first couple of years. Why is it that this job, why are so many people leaving DCS?
Well, first and foremost, I think it's because a couple things. One, I think that we have to pick the right people. You know, people sometimes have an idea of what it might be like to work in this kind of work. It is not for the faint of heart. So we're trying to, in our training program, trying to identify the right people, and then once we get them, the training be such that they have field experience almost right away so that they know, gosh, I don't want to go into someone's home when they're cussing me out and, you know, it's dangerous and this isn't for me, so that we can kind of eliminate those that don't fit the bill correctly. Not that they don't, but that the work is not really good for them. And secondly, I think the work that we do is awful. Nobody's happy. Sometimes children die. Sometimes children are maimed. Sometimes they're sexually and physically abused. And it's very difficult work, and you have burnout. You have people that suffer from secondary trauma, just like police and firefighters. So we're trying to support the staff in a way that maybe they weren't supported before. Again, our training is trying to be more about taking care of ourselves too, as well as the kids, so, because if we're healthy, then we can do our jobs better. Picking the right people, encouraging people to get bachelor's in social work and master's in social work, because data shows us that children achieve permanency faster with that kind of person. And so we're doing. The good news is that our turnover when I got here was at 26% overall, agency-wide, and today it's under 15%. So in 15 months, I think we've done a pretty good job. We're not done yet, but we're still working at it.
Well, speaking of turnover, when you left here as judge in Lake County, juvenile court judge, I think you'd been here since 1993 as the juvenile court judge.
And 82
there you go.
Total, yeah.
And there was a back and forth on who should take over for you. Ultimately, Judge Stefaniak got the job. What do you think of that choice?
I think it's great. I think, you know, all along, even before I even left or was thinking about leaving, I would, you know, occasionally think what would happen. I would think, gosh, if one of the judges that are sitting takes it, I hope it's Judge Stefaniak. He's very engaged. He wants to learn. He's very open-minded, and he's just a good guy. He's salt of the earth. He's, you know, somebody who is one of us. And not that the others aren't, but I just think he has a certain interest and knack for it that I think he'll be great.
Mary Beth Bonaventura, head of the Department of Child Services, thank you so much for being on.
Thank you so much for having me.